you're a good surgeon, so you go back to Italy, you have patients. No, that's not how it works.
How it is possible that Italian guy stay in Sweden?
Every time I go see somebody else operating, I can learn something.
Old faculty, they always try to bite you.
There's always been this kind of mentality where the big guys, they don't want the small guys.
You bring a lot of new blood.
Maybe the implants are not incredibly different from 20 years ago, but the techniques are getting better and better.
Paolo, first of all, I'm so happy that you managed to come to Moscow, because I think that you are a completely new person for us, for our doctors. So thank you very much. I know that you are working very hard and it's very limited time in your schedule, but you manage it. So
I manage it. Thank you for having me.
Yeah.
It's my first time in Russia.
Yeah.
Not in Russia, actually. I've been to St. Petersburg once,
Okay.
but my first time in Moscow.
First time in Moscow, that's great. When you
Yes.
have been in St. Petersburg?
I was maybe 15 years ago, so many, many years ago, yes.
So I think you should come back because it's really a lovely city.
Everybody says so.
Yeah. And actually it's John Memasi who told me, Olga, let's do Moscow in February because it's a lot of snow. So I'm really not sorry that we don't have snow.
No.
I am very happy that it's a sunny time and we call it European winter, and it's really very good. Because I think Moscow is beautiful even in without snow.
Definitely.
Yeah. So, Paolo, you are completely, as I mentioned, you are a completely secret person for us because we don't know much about you. So I will appreciate if you will tell me, how did you become a plastic surgeon? Plastic surgeons is a top quality doctor who should handle many knowledges about the many surgeries and psychology
Right.
of the patient as well.
When I was a teenager, my father, he used to be a doctor, so I always thought I would become a doctor too.
Really?
Yes, he was a cardiologist. But when I started studying medicine, I realized pretty soon that I did not like cardiology, so I didn't really know what I would do. And I came across plastic surgery, because you have to study all topics when you are a medical student. And while studying plastic surgery, I thought it would be, fantastic to go see some operations. So I went to the professor and asked him if I could join the OR for the first time in my life. And when I went in there, I thought to myself, this is what I want to do, just like that. So
So simple.
I knew
Sounds
it.
so
I
simple.
knew it that's what I wanted to do. But when you are at the hospital as a resident, you don't really get to do much of cosmetic surgery. You do a lot of reconstructive surgery. For example, breast reconstruction after cancer, or scars or tumors, or those kind of things. But I also wanted to learn the cosmetic surgery, so I went for a fellowship in Stockholm. At the
From where? Where was your base?
My base was this city called Varese, which is very close to Milan. It's like 50 kilometers north of Milan. That's a big city.
I know
where
Varese.
I did all my studies there.
It's the biggest university in Varese?
It's a big university, yes.
Yeah.
Yes. So I did all the university and the residency there. So I was looking for a place for a fellowship, which means like a 1 year period of time, to improve my knowledge and skills. And I found this place, which is an amazing place in Stockholm, which is called the Academic Clinic, and which is a very famous clinic where Per Den was there, a lot of very important surgeons. And I went there for 1 year, and at the end of the year, they actually asked me if I could be interested in staying instead of going back to Italy. And obviously I said yes right away. So I was in Sweden for many years, learning from these huge surgeons there who taught me cosmetic surgery and breast surgery a lot.
It's very interesting because we know Per Hedden very well.
Yes.
He have been many times on Moscow Breast Meeting,
Of
and I
course.
think he is a great person. And what is important, he loves to teach. I mean,
Yes.
all of his presentation, it's like, you could start immediately to do
what he says,
what
yes.
he said,
Yeah, he's
yeah.
my mentor.
Yeah. That's great. And I think Academician Clinic, it's one of the clinics who everybody wanted to make a copy because it was a successful business model.
Yes, and absolutely. And I can tell you that, this story was, when I went to academic clinic, it was, I think, 17 years ago. But still now we have a lot of young surgeons asking to come to academic clinic and to see the surgery, to have a fellowship, to spend some time with the surgeon. So it's still a very popular clinic.
So you're still working there, yeah?
I'm still partially working there because right now I have moved back to Italy, not completely, but I do basically 70%, 75% of my time in Italy. So 3 weeks out of 4 in Italy, and only 1 week per month I am going to Stockholm. So it's nice to have both.
Very personal question. How it is possible that Italian guy stay in Sweden?
Well, coming from the north of Italy, in Milan, it's not as in the south of Italy where it's warm, and in the south, in the north of Italy, in Milan, it's cold in winter. So
it's not so cold as in Sweden.
Not as cold as in Sweden. It's true, but Stockholm is a beautiful city,
Yes, in summer.
In summer,
the
yes.
same as St. Petersburg.
It's true, but I thought back then when I moved there that working there was so special that I didn't care about the rest. So it was just for work.
Yeah,
That's
great. So I also know that you publish and you create a lot of scientific papers. This is very rare because usually plastic surgeons, they don't like scientific papers. They like to show the results, and definitely they do some research, but it's not very scientific. You're the rare one who do a lot of scientific research. Why?
Well, that's true. And I think, when you go to a conference and you see people on stage, just like you say, and telling, their results and everything, I always think to myself, yes, but how can I be sure that what you're saying is actually, what it is, and the only way is publishing. If you have your own method, or if you want to evaluate your own results, the only way to do that is to, go home, open your computer, gather the data, and then come up with your studies. And I've been doing this since probably many years back now. I've published a lot, and also having the fellowship at Academic Clinic, it gives me the possibility to have a lot of young doctors helping me in writing papers. So yes, I've always been very active, and I believe that when you go on stage and you present your own personal data, basically nobody can tell you anything because that's your data, and it's peer reviewed, so it's really solid. So I think it's very important. I think more people should do it because, just like you said, cosmetic breast surgeons, they don't really do it very much.
Yeah.
It's more for like reconstructive and stuff. But I think, giving really like lectures on some data that is your own data can really make your point stronger. So I think it's something that more surgeons should do.
When you moved from Sweden to Italy, how did you organize your business? Because the patients, they always searching, academician clinic is a famous one. So how did you organize your...
That is a very good question. And when I moved back to Italy, it was just like starting from scratch. People think, but you're a good surgeon, so you go back to Italy, you have patients. No, that's not how it works. Nobody knows me in Italy when I go back there. So I had to go back to Italy gradually. So first I did 1 weekend a month, 2 days in a month, doing some social media, and maybe I would go back to Italy, have 2 patients, 2 consultations. Then, little by little with social media, with advertisement, with local newspapers advertisement, all that kind of things, I went to 2 weekends a month. Then it was 1 week a month, then 2 weeks out of 4. And then, little by little, you have to grow your image. Because when you do cosmetic, like myself, it's all about your name, and you need the time to build up your name. And still now, and I've also done a few lectures about this, I think that the role of social media and advertising yourself is very important if you want to be...
in this field, for sure.
Definitely, definitely.
Is it a big difference between the patients in Sweden and the patients in Italy? For instance, in Sweden, they want to have bigger breast, they want to have round implants, or...
I would say that if you compare Sweden to north of Italy, where I live, there's not a big difference. But there is a big difference if you compare north of Italy with the south of Italy. Sometimes I joke with my colleagues in Italy, and, I tell them that usually the implants that I use for breast augmentations, they're never... they're between 250 cc's and 300, 315. And they tell me the ones that are based on the south. Well, here in the south, you don't even start talking about the breast augmentation before 400 cc's, you know. So it's about a cultural thing. But Sweden and north of Italy, very similar.
Really? So Sweden doesn't want to have a bigger breast now?
No.
Because they're big, like they're big people.
They are tall people, but they're not big built, you know. So they usually don't ask for very big implants. And also another thing I think is important is that, considering that I have a big presence in my social media and I show the patients what I do, and everybody sees, you know, my pictures, and they see that I don't do big breasts. Probably those who look for me, they know already that I'm not doing big breasts. So when they come to me, they already know that I only do like moderate breast augmentation. I think it's also about the image that I give them with my social media.
Also know that you pick up this Maurizio Nava meeting for the aesthetic breast, which was very successful. Then it was COVID, all of these issues. And then Maurizio decided, I think that he's getting old and he wants to have some freedom. So you decided to take this responsibility, because it's a completely different business, completely different. It's not clinic, it's not surgery, it's education, it's completely different. Why did you decide? Do you like teaching? In the last meeting which I attend and where we met with you, I had information from all the doctors which I know, and the young one, and it have been few Russian one. They told me this is a fantastic meeting, because the one which have been old-fashioned with Maurizio was not so good. So, I mean, maybe it was old-fashioned, and you bring a lot of new blood.
Thank you for this question. I love this topic. I have always really loved teaching. You know, I've always been involved in this. The publications that you mentioned, that's also some sort of teaching. I've been, you know, involved in a lot of master classes also, and the teaching is always something that, I don't know, you know, I like to be on stage and share, you know, the knowledge. And when Maurizio Nava, who has been running this meeting for over 20 years. So we're talking about one of the biggest meetings in Europe for breast surgery. When he asked me if I would be interested in taking over the meeting, well, I didn't even have to think, you know. it was for me, it was such a huge honor. And obviously I said yes right away. I said, under the condition that you're going to be with me at least for the first 1 year, you know, in the back, to help me organize, and which we did. And this year, last edition where we met in Milan, it was something new, just like you mentioned, because I wanted really to make the meeting also very young friendly. So these meetings, usually these big meetings, they are very much they're very good meetings for experts, or for those who already, you know how to do a breast augmentation.
How to fight.
Or that too, yes. But for the young people, you know, sometimes you go to these big meetings, you see a lot of very big speakers, but it's a little bit too advanced for them to really, you know, bring home something. Yeah. So I wanted to do both. So we kept, of course, the big talks with the big guys, but also we had an entire afternoon that we called the MBN Young. So it was dedicated to the young people. And I think that a lot of young people really appreciated that. We had a lot of attendees, young people coming to the MBN. So just like you said, it was like a refreshing of the meeting. And yeah, I hope I will be doing this for many years to come. And
so great, congratulations and good luck, because we have been in the auditorium last day, almost at the end of the meeting, and it was full.
That's true.
There's only one thing which have not been in the auditorium, it's air.
That's right.
Yeah, because the auditorium was full.
That's right.
Even in Milan, it was a great weather. It was not so hot. It was okay. It was okay. Yeah. So. Yeah, I think it's a big success, because it's very difficult, like for us as well as organizers, it's very difficult to bring the new young people, because first of all, they think that they know everything. Second, they want, I think the issue that they want to have the information fast.
Yes.
They don't want long stories. They want, show me how to do it. I will try to repeat and will do my experience.
Yeah, no, but just like you said, for me, it was something completely new. Yeah. I've been participating to meetings as a speaker to many meetings. But when this year, for the first time, I found myself organizing the meeting, I understood and I realized how difficult it is with all the aspects. You have to speak with sponsors. You have to find the people who want to come. You have to target. You have to go on the social media the right way with the right timing, and it's very different. And the young people are very different to reach. So we actually try to have some access to their chat. They have, like in Italy, they have this chat that is the resident chat. So we infiltrated a little bit in there, trying to share the information that we would be out with the young session. So it worked out fine. It went very nicely.
What will be your suggestion for the young surgeons? How to become an expert? How to become the person with the less risky surgeries and with the good results?
Well, this is also something that I find as a very good question because, like you said, many young people, they want things fast. And I said, what I usually tell them is forget fast. You have to learn a little bit, step by step. So I think obviously, you have to go see people operate. I think the congresses, just like this one, is a beautiful congress, or the congress in Milan, are fantastic ways to come and see big people talk. You can for sure learn something, but then you can also make a lot of connections. You can meet the people and you can ask them, can I come see you operate? And then when you go and see the operation, then you will really learn the tricks, the manuality. So my very big piece of advice to young surgeons is, don't be afraid to ask, can I come and see you? Sometimes I still do that. I still go to see people operate myself because even if I probably have reached a good level, but still I think that every time I go see somebody else operating, I can learn something.
In our society, it happened the same when the young person goes and tries to present. Of course, the same as a surgery. You couldn't perfectly present if you never had any experience. It could be some difficulties even in making a slides. Old people, old faculty, they always try to bite you, to say, and this is not good because we found out when we try to find the new people, young people to present, they have been afraid. And then I told them, listen, we will have the board, they're very friendly, so they will ask you the right questions. And when you will get the right questions, you will try to think how to answer, and maybe you will need to change something in your surgery, in your practice. It's like mentor. So you need to teach people how to present, and then it will be very interesting conversation.
And they don't need to be afraid, just like you said, because we all started from something, so obviously, you don't have to be afraid. If you find like a tutor or somebody who can help you, that really will make a difference to you. That's why I'm saying that the young people need to find connections and meet people, and they will find their tutor, their mentor, or, I have a few people coming, to me and say, can I come see you doing surgeries? Of course, I think it's an honor for me when people ask me if they want to come and see me, of course, And in Italy, I don't know how it is here in Russia, but in Italy, there's always been this kind of mentality where the big guys, they don't want the small guys. But I think it's the other way around. In Italy, if somebody comes to me and says, can I come see you? Of course, come. It's fun for me to have somebody around, when I do surgeries and I can explain. So, yes.
Yeah, it's a little bit better now because we also did a lot. We tried to explain that communication and connection brings to both sides, not only to
improvement
one side.
To all sides.
Absolutely. And then because now we reach the level when, for instance, if the patient had the surgery in Moscow and then goes back to Vladivostok, the doctor from Moscow could call to the doctor to Vladivostok and ask him to do the changing the
dressing.
Absolutely. So I think this is our big success in terms of doctors start to communicate, not be jealous to each other, but start to communicate. And this is really very important.
Yeah, sharing will make the whole plastic surgery work better. And if you have a better plastic surgery ward, then it will be more patients doing surgery. So it's a win-win, Yeah.
What do you think, which kind of new technology changed the breast surgery?
Well, I mean, it really, I cannot see something over the last year that has really made breast surgery revolutionary, but there are a few things that I think that have made surgery better. For example, we have now implants that are made with a softer gel, or with less weight. We can have a better way to put the implants in. I personally use like this insertion funnel, which is something that allows me to do as a shorter incision. And obviously, women like shorter scars. You know, if you tell them I can do the scar, I don't know, by 1/3 shorter. Even if 1/3 is only 1 centimeter, everybody's happy to have a little shorter, right? You can do the surgery in a completely different way, because while some time ago, breast augmentation would be very traumatic. You would go with your finger, you would do the pocket with your finger, and patient would be in pain after surgery. They would have drains, because when you go with your finger, you create a lot of trauma, so you have blood coming out. Nowadays, my patients, you know, they go home and they're basically pain-free. Almost no pain, and this is something that is concerning me, because if they don't have pain, then they think they can do a lot of things. But I tell them, exactly. So I think, you know, what really has changed over the last years is the kind of experience that the patient has for the surgery. Once, let's say 20 years ago, or even 10 years ago, the patient would do breast augmentation, and they would be home for 2 weeks in pain with the drains, a lot of dressing and all the rest. Nowadays, my patients, if they have like a desk job, they can go back to work after 2-3 days. They don't have drains. They can shower 2 days after surgery. They can go for a walk the next day. So the whole experience is much lighter. So I think, you know, this is the direction that surgery goes into. Maybe the implants are not incredibly different from 20 years ago, but the techniques are getting better and better.
Paolo, and the last question. What kind of topic you will present in the Moscow Breast Meeting next year?
Oh, well, I'm very open. First of all, I hope I'm invited next year too, because I thought, and I have to say this, I didn't expect this big meeting. It's a lot of people, the room is always full, and it's been fantastic. So considering that I have presented, I think, 4 topics in this meeting, I don't know, I have to think about something new, come up with something new. But yes, I will definitely think about something new, some maybe new results that I've studied, and maybe small techniques and adjustment tips and tricks. Those kind of things are always interesting.
Okay, thank you very much for your interview, and I hope, first of all, I hope to see you in Milan for your meeting, and definitely you are invited, and we want to listen from your scientifically based data information for plastic surgeons in Russia next year.
Thank you so much for having me, and I will definitely be here next year too. Thank you.